Okay.
Yeah.
Hi, I'm Jessica Barron. I'm a National Health GP and I also work in a private menopause clinic.
Hi, I'm Dr. Justine Setchell. I'm also a GP and also a hormone health associate with Jessica.
And we're going to talk about how to get the best out of your consultation with your GP. So the first thing is actually get that appointment.
Oh, thank you.
Oops.
There you go.
Oh, sorry. You want to find out from your general practice who's the best person to talk to, who's interested in hormones, who's interested in women's health. Even if you have to wait for that appointment, don't go to someone who's going to say, I don't know anything about this, I'm going to pass you on to my colleague. And don't turn down an appointment with a training doctor, because they very often know a lot more than the older doctors about current menopause, and they will also have longer appointments, which is very useful for you to have. Ask your friends, ask your family, who do they go and see? And more importantly, what are they on? You'd ask them about lipstick, you'd ask them about face cream, ask them about the hormones and the type of hormones they take, because any information you bring to that will be useful for your treatment. If at all possible, try and get a longer appointment, and also ask if you can choose whether you have a face-to-face appointment or a telephone appointment. Both are possible.
So where do you look for accurate information? There are many sources of information. I think top of the list in my book would be the British Menopause Society. It's where all us doctors would go to get the most accurate scientific information, the latest NICE guidelines, and usefully HRT supply issues. They're quite good at letting us know what we can get where when there are supply issues. But that can be sometimes a bit daunting, a bit scientific, but they have a patient arm called Women's Health Concern, which is much more digestible. They have really good leaflets, patient leaflets. They have a menopause hub, so loads of different information for you to access there. Menopause Matters, similar to Women's Health Concern, that was actually set up by the current chair of the BMS, Dr. Heather Curry, so reliable information. Obviously, it would be remiss of me not to mention Hormone Health, since we work there, but we produce very good newsletters and social media posts. And as Jessica says, it's always worth asking your friends, where do you get information from? Open up that conversation. Social media, obviously there's a mass of stuff out there, but proceed with caution. It's really finding out who has further qualifications in menopause management, or again, a trusted source. So if a friend has found something useful, then follow their advice. But it can be, if in doubt, if you get a bit overwhelmed by the amount of information, go back to Women's Health Concern, and that will have the most sensible information available. So lifestyle changes. Now, I was going to talk a lot about this, but then I arrived at this venue and decided that would be a bit daft, because there's so much stuff going on, loads of fantastic talks, people who are going to delve deep into all of these different aspects, including our esteemed colleague, Mr. Nigel Denby, a dietitian, who's speaking after this. So I'm not going to go into great detail, but just to say that HRT is not a universal panacea. So when you're going through your menopause, it's not just about sort of slapping a patch on and everything will be all right. It has to be a joint effort, and your job is to look at the different aspects of your life that you can improve. So looking at stress, looking at diet, exercise and sleep, all of which will help improve your symptoms as much as HRT. So if you do all that together, you stand the best chance of getting better more quickly.
Right, you've got your appointment now. So what do you do to get the most out of that appointment? Be prepared. If you're offered a health check by your surgery, which I think a lot of people are nowadays, go and do it. Get your blood pressure done. It's like getting freebies from a place like this. Get your blood pressure, your weight, you'll be offered a blood test. If you feel that you might need someone to look at your hormones, ask them just to add it to the blood form. It's very easy, it's 2 clicks on the computer. And then someone else will look at them and tell you what is going on with your body. Make sure you know a list of your symptoms. You may need a box file to put all your symptoms in, not just a little notebook. But there are a lot of, if you can't think of them, there are a lot of symptom checkers that you can get. Pause Live on the website has a symptom checker for the menopause. Menopausesupport.co.uk has. There's also something called Menopause Info. Download them, fill them in. And don't forget, you don't have to have all of these symptoms to get help with your menopause. The GP will help you to sift through what they know is menopause related, but what can also be due to other things you have. Make sure that you're up to date with your own medical history and your family history. Tell the doctor about the other diseases that you may have. And if you've got a family history of anything, let's say breast cancer, if you can get any information about the type of breast cancer, that will also help very much with knowing what may be right for you. And secondly, what drugs you're on. Okay, your GP should have all this on their computer, but it might be a new GP who doesn't know how to use the system. Bring a list of everything you're on. And if you're taking any supplements, take a picture of the box, take a picture of the ingredients, or bring the box with you, because there are some things which interact with normal hormones. And also, if you have had any blood tests elsewhere, any scans, any x-rays, smears, bring them with so that you've got all the information to hand.
So key questions to ask when you finally get the unicorn appointment.
Okay, the first thing is, what options do I have? So, first of all, non-hormonal ways of dealing with your menopause. Plant-based treatments, plant-based estrogens, all the lifestyle things that Justine has touched upon, like having a good time and going out there and enjoying yourself. That's obviously one of them. Another thing which is very much now part of the menopause treatment arm is cognitive behavioral therapy. So this is not necessarily instead of, but it's as well as. You might already be having some form of therapy, but it is really very useful as an adjunct to everything else you might be getting given. And then there's hormones. So hormonal replacement therapy is the gold standard of the medical treatment. Justine will explain a bit what we give and what we use, which in general practice is all good, safe stuff. The other thing to mention is vaginal estrogens. So this is very useful if you have a dry, uncomfortable vagina, either during sex or just generally if you're not having sex. You deserve to have a nice, healthy vagina, and that is very much part of the treatment.
How safe is it for me? Obviously, that's at the top of lots of people's questions. We prescribe regulated bioidentical HRT. So this is prescribable, evidence-based hormone replacement with naturally occurring estradiol, naturally occurring micronized progesterone. And arguably it's safe for the vast majority of patients, but every prescribing decision needs to be done on an individual basis, so risk-benefit would be assessed. But just to briefly say that I think vaginal estrogen is often overlooked, in that a whole year's worth of vaginal estrogen is equal to one estradiol tablet, so it's ridiculously safe and can be used for the vast majority of patients.
Make sure when you leave your GP, you know how to use what you've been given. It's all very confusing. When I'm in my surgery, I give my patients a little diagram of when they're supposed to be using which patch and which tablet. You can get HRT in all sorts of forms. You can have tablets, you can have gels, you can have patches, there's even a spray. I'm afraid it's not got any perfume in it, but it's good nevertheless. And it's an individual thing. One might suit your lifestyle better than the other. And the most important thing to know is that what you get given in the beginning, you don't have to stick with. So try it for 3 months. You're usually given a 3-month prescription. If you don't like it, or if your best friend has something else which she likes better, ask the GP to change it. They will and they should.
What about testosterone? Sadly, it's not a wonder drug. I think a lot of my patients come in and think that will fix everything. And it is better than the alternative HRT, husband replacement therapy, possibly. But it's not for everyone, and not all my patients seem to need it. So I usually give it to people after after their estrogen level has been restored and they're balanced on their HRT, estrogen and progesterone. Hang on. You can probably still hear me if you've got your headphones on. I'll keep going.
Oh, okay. I can't.
But even the people it works for, I'll give them a prescription for 3 months and see whether it's made a difference within that 3 months. It is licensed for distressingly low libido, so it is in the NICE guidelines, and your GPs can prescribe it, but bizarrely there are no licensed form of testosterone for them to prescribe, so they're prescribing off license. So I know that sounds a little bit confusing, that they're recommending it and then not providing us with something to prescribe. So sometimes GPs who are less confident in menopause management, some would hesitate to prescribe testosterone, but you are sort of entitled to it. So just find a GP who does understand and will prescribe it for you if we think that's needed.
Okay, and talking about the 3 months, a GP should give you as the first prescription 3 months, not 1 month, 3 months, because you're not going to, it's like the pill is always prescribed for 3 months. You might have a few side effects in the first month and you'll feel the real benefit during that first 3 months. So make sure that they give you a 3 month prescription. Your first prescription will not be on repeat because they'll want to see you again in 3 months to make sure it suits you, that you don't want to change, that you're not getting a rash from the patch and want to change to another type. So, but after that, you will be able to get this on repeat prescription, which will make your life a lot easier. The vaginal estrogen that we mentioned can always be given on repeat prescription, and you can have it until you're 85 and over if you want to.
In fact, that's available over the counter. You can actually
yes,
buy that
nowadays
in the form.
you can actually buy it over the counter.
And it is available just to buy. That's how safe it is. It's just important for people to understand that. And then lastly, HRT prescription prepayment was introduced recently, which has been a bit of a game changer for a lot of people. So that's £19.30 for a year's worth of HRT. Normally, unfortunately, because you're having to take, most people with a uterus anyway, having to take estrogen and progesterone, you pay 2 prescription charges per prescription. So if you're having a 3-month prescription and then a 6-month prescription, etc., that adds up. So it's worth, you can do that online or via, put my teeth back in, participating, it's too many P's, participating pharmacies. And you can set that up for yourself and then just pay once in a year for all the HRT that you might need. So I think we've come to the end of what the questions we thought people would ask, but we'd be happy, well, our stand, actually, Hormone Health stand, happens to be just there, to the left of us or to the right of you. So that's where we'll go afterwards. So if you have any further questions that we haven't covered, because it was a bit whistle-stop tour, then please feel free to come and chat to us.
We do have a little bit of time for questions now, if anyone does have any in the audience.
Anyone got any questions? I know it's difficult. People always say it's difficult to get an appointment with your GP, but it is difficult to get appointments with GPs.
But not impossible.
But not impossible. And I think if you're willing to just wait for that appointment, it's really important to get the right person who you feel comfortable with. I suppose it's in a way, if anyone has a therapist, get someone who understands that if you have to wait 3 or 4 weeks, it's worth it to get the right person.
Yeah, and I suppose, like you said at the beginning, it's making that inquiry at the beginning of who is the menopause specialist in your GP surgery then to work out who's the best person to see straight away. So if you have got to wait, then you're seeing the best person.
Fortunately, I would argue, I think the days of the single-handed male GP practices are gone, certainly going on, hopefully gone.
Yeah.
So most practices have a number of GPs.
Yeah.
So you're pretty likely to be able to find somebody.
And a selection of different. And the other thing that when you have, after you've had your 3-month review with the GP. After that, you will need a yearly review of your HRD. You might want to change it. And one of the best people to see are the pharmacists. So I forgot to mention, most practices now have a prescribing pharmacist, and they're really good on knowing what is you can change, what side effects you should expect, how to deal with them. And if they, of course, they don't know, they'll just come and ask me or the doctor who's there. So there's a big lot of different people nowadays in a general practice who can help with this.